Hi, welcome to Civic's Change Agent Chat, episode 31. During these chats, we speak with change agents who are working to create a better healthcare system for us all. I'm Stephanie Spriggs with the Center for Improving Value in Healthcare, or as we like to call it, Civic. In this chat, Sharon Adams, Civic's former Community Engagement Manager, is speaking with Denise Denton, Executive Director of Aurora Health Access. Historically, those with more resources have better care, and therefore better health. Aurora Health Access is working to circumvent these factors and ensure that all members of the community have access to health care regardless of economic standing. During this chat, we learn what programs are in place to address population needs and the outcomes that have resulted from these programs. We recorded this chat in July 2018. Thanks for listening and enjoy the chat.
I'm the Community Engagement Manager here at Civic, and with me today is a colleague, and I will own the fact that she's a dear friend, Denise Denton, who's the Executive Director of Aurora Health Access. So before we kind of turn things over to Denise and have some conversation, there are a few things I need to cover with you from a housekeeping standpoint. The phone lines are muted, and we'll be using the Q&A feature to field questions and allow you to make comments on the discussion. Questions posed will be answered during the Q&A session, which I believe is about 30 minutes into our total time together. Is that correct?
About 20 minutes.
20 minutes into our total time together. And the webinar is being recorded, and it's going to be posted on the Civic site, so you can access the information again at any time without cost. So, hello, my friend Denise Denton.
Hello, Sharon.
Denise and I have known each other quite a long time, and our roots go back to Rural Health Access, which Denise is by far an area expert in. But today, we're going to talk about Aurora Health Access and maybe begin with, well, maybe we want to know a little bit more about you than what I just said, and then we can talk about how Aurora Health Access got started, and we'll take it from there.
Well, as Sharon said, most of my career was spent in rural health care. And in fact, I was recruited to Colorado from Arizona to start the Office of Rural Health in Arizona, here in Colorado. And when I was hired, I told them, I love what you're doing, a group of, citizens, residents setting up a not-for-profit Office of Rural Health. But I'll give you 2 years. I don't quite get this mountain thing you have going, and I don't have family here, but I'll give you 2 years. So that was 25 years ago. I kind of get the mountain thing that's going now, and it was my pleasure to work to start and then run the Office of Rural Health in Colorado for 16 years. So it's unusual to be in Aurora now, where they have more than one hospital, but I'm enjoying that. They have so many things in common with what I did in rural healthcare.
Sweet. So let's talk a little bit about Aurora Health Access, maybe how it started, and maybe you can give people a little bit of insight around health alliances in general, not a deep dive in that, because we want to spend our time talking about Aurora.
Sure. Well, Aurora Health Access started about 9 years ago. The parishioners from St. Teresa's Church, which is a church in Northwest Aurora, were concerned and frustrated that there were so many health resources in Aurora, especially, this is when the Anschutz campus opened, so suddenly there's Children's Hospital and the medical schools and University Hospital, but there were still people without access to care, and wanted to understand why, and realized that people didn't seem to be talking to each other. So a group of citizens from this church started hosting meetings, and they started meeting quarterly, attracting the stakeholders and leadership to come, and just to better understand why people didn't have access to the care they needed. They were very fortunate to get a grant about 4 years ago from the Colorado Health Foundation, sort of to see, well, what do you want to be when you grow up? Because it was an all-volunteer a community group at that time, and evolved into what we call an alliance, a community health alliance. And there are 22, I don't know if they're counting Douglas County, that's our newest alliance, so maybe 22 or 23 alliances in the state, and very different. Some of them have multi-million-dollar budgets, like the one in Weld County. I'm not jealous, not terribly. Others are still just volunteer-based. What we do have in common, and I should also add that many of the larger cities, Boulder has an alliance, Denver has an alliance, Mile High, Douglas County has an alliance, and some, especially in rural areas, are multi-county. What we have in common, despite those differences, are that we all are, our main priority is improving access to care, especially for our most vulnerable and underserved residents. And it's also multi-representational. It's not just nurses or emergency medical providers or public health. It's a broad range of the public. Some are more grassroots than others, but it's a broad-based group, and they have some interaction feedback with the community to help set health priorities. So that's what alliances are.
Thank you for that primer on alliances. So let's talk specifically about Aurora. And when you and I were visiting before we got started, I checked in just to be sure that increasing access and expanding coverage and building collaboration are sort of cornerstones of your work. I think given Aurora and its size, so maybe you could talk to us a little bit about the bigness of it. And then I think we'll spend some time talking about the diversity. And then before we step off into maybe some more programmatic pieces.
Well, Aurora is our second largest city. We've got somewhere between 350, 360,000 people. And if you're familiar with Aurora at all, just imagine, look at the changes that they've gone through in 10 years, with the changes at Fitzsimmons, with the Anschutz campus, with the airport moving. That was longer than 10 years ago, but with the changes at Lowry, which is not quite on Aurora, but you know, it butts up against the side of Aurora. We take up 3 counties. Well, we don't take up 3 counties, we touch 3 counties. 87% of Aurorans live in Arapahoe County. We've got another 12% in Adams, and we've got about 600 people, I don't know many of them, living in Douglas County. And so one of the challenges we have is collecting data, because you know how often data is around county. So we're so grateful for some of our partners, like here at Civic, that dig a little deeper into data to help us understand what some of our needs are and where we, things that we can work on, what our priorities would be. And I know we're going to talk more about it later, but another thing that Aurora is known for is the diversity of our community, because for many years, I don't know how true it is now, housing prices were less than in Denver. And so our community is a wealth of people from so many different countries and cultures. I read somewhere that 136 different languages are spoken at Aurora Public Schools. And so 1 out of 5 people in Aurora weren't born in this country. So very rich culturally, but also that can present some challenges when you're talking about healthcare access and building collaboration.
Well, and when you're talking about care, how do you communicate when there is that much diversity in the provision of care and services? Right?
Well, I think about how complex our healthcare system is if you lived here all your life, if you work in healthcare, and then imagine trying to make sense of the system, which between us, I don't think makes a lot of sense, and explain that to somebody who came from a country where either they had no healthcare or had healthcare that everybody had access to what they needed, and trying to explain to someone why you should go in and take your child in even when they're well. And yes, we built this beautiful emergency room that's open 24 hours, but don't go there. because then you're an overutilizer. You should find what we call a medical home, but don't get me started on all that. It can be very confusing.
Yeah, and pretty dynamic, right? So let's, so I'm going to flip a little bit I wanted to go into the refugee and immigrant space, but I'm changing my mind.
Okay.
So let's talk a little bit about focus areas or programmatic areas for you.
Sure.
And also a little bit about membership. So you can start whichever of those spaces makes the most sense.
Aurora Health Access is a membership community. We have a very, very rigorous membership standards. It can take a long time to become an official member. You have to ask, pretty much.
I was going to say, Denise has her tongue in her cheek, as she's saying that. So
anybody who believes in our mission, which is improving access to care, especially for the most vulnerable and underserved, can be a member. We have over 2,000 members now, and unlike some alliances, which are consumer-based, most of our members work or are otherwise engaged in Aurora's healthcare system. In a way, what we do, there are so many wonderful healthcare resources in Aurora. We think there's a capacity to take care of just about everybody if we did things a little better, if we talked to each other, if we paid attention to who's falling between the gaps. So most of our members are people who agree with that and are part of the healthcare system, but they want to make it work better than it does now. The work that we get done, our members choose priority areas. Well, our members always say housing costs are one of the most, but we can't do that one. So we tell them, what else you got? And so we pick some of their further down the list. So we try to, with the members' help, pick areas where we think we can make a difference with the partners that we have and the resources. So we have a series of work groups or task forces that anyone can join. Those groups meet every other month. And I'll list them. Yeah. We've got one that focuses on children's health. We have another one, actually our largest is the Senior Circle. It's concerned with access to care for seniors in Aurora. We have one looking at social determinants of health, things like having the food that you need, having transportation to get to the health care that you need, safe housing. We just did a whole project on mold in the motels along Colfax where many of us, don't get me started on that. We have a fairly new group called Aurora Smiles. We want kids to get, well, not just kids, even seniors. Seniors are the most underinsured group with oral health. Medicare doesn't cover oral health. So we came together with the School of Dental Medicine and DentaQuest and private dentists in Aurora. We work together to offer free screenings and tell people where they can get affordable oral health care in Aurora. And then we've got a group looking at access to specialty care. So these groups take on different projects, help build collaboration between the entities, learn more about the problem that you can, for example, access to specialty care. You can think, well, the doctors just won't see people, but it's much more complicated than that. And we learn about that together by having different people at the table.
Great. So Denise and I obviously have talked a little bit about what we're sharing with you in advance, but Stephanie, who you don't see but is with us, is telling me there are a few questions already.
We have about 10 minutes for questions.
Okay, so I wasn't sure whether I needed to maybe accelerate that. All right, so you guys know that we know you have questions, and we'll get back to those.
I hope they're not hard ones.
Yeah, somehow I feel like you're going to be able to answer them regardless. Can we talk a little bit about refugee and immigrant communities, and especially those who may not have documentation?
Oh boy, you picked an easy one,
I did.
Sharon. You did.
As
I mentioned, Aurora is very fortunate with the incredible diversity we have in our population. But just imagine trying to understand our healthcare system, and I'm going to do a little quote thing when I say system, if you're not from this country, if you don't speak English fluently. And so it certainly creates additional challenges. As an example, one of the problems that we heard from our members was if you are without documentation, if you're not here as a legal resident, if you don't have a social security number, if you go to the website about buying insurance, because let's say you can afford insurance, it says you can't buy insurance on the exchange. You're not a citizen, but you can buy in the private market. We couldn't find one insurer who would sell to you if you don't have a social security number. So we're also fortunate that we have the School of Public Health in Aurora, and students sometimes do projects. So we have this wonderful student who agreed to call every insurance company that sold individual policies in Aurora and said, can I buy insurance from you? I don't have a social security number. It's a good thing she was volunteering because she was on hold a lot. I'm glad we weren't paying her. And was told it's illegal, we can't sell to you, we'd love to, but anyway, we figured it out. There was, at the time, 2 companies that would sell an insurance policy to you without a social security number. One was Kaiser, thank you Kaiser. The other one was the now defunct Colorado Health Co-op that was started by the Affordable Care Act, and we're not even going to go there.
No, we're not going there.
But that's just a small example. Also, undocumented people who are not legal residents have trouble accessing some of the services in Aurora. Certainly not everywhere. We have, for example, the Dawn Clinic. I'm so proud of the Dawn Clinic. It is a clinic started by the students on the Anschutz campus, and they provide free care for people that have no insurance. And so most of them are undocumented because if they have Medicaid, they can't go to the Dawn Clinic. It's only for adults right now. And I tell you, if I'm feeling a little bit beaten down by the work, the continual challenges in improving access, I go to the Dawn Clinic on the Tuesday night that they're open, and I tell you, it just, that's why we do what we do. The patients that are waiting, the students that are just waiting to help, and they will move heaven and earth to get what these patients need. The stories, I tell you, I can make you all cry. But so even though there are some challenges, we have some amazing resources in Aurora to also try to deal with it.
And amazing restaurants. Did you already
say that? We have amazing restaurants in Aurora. Amazing. Any kind of food you want.
Vis-a-vis diversity and inclusivity, amazing restaurants in Aurora. Want to talk to me about any additional challenges or most pressing things that you may not have touched upon? I think the senior oral health thing is,
senior oral health.
I think we typically think about kids.
Yeah.
But my personal experience has been we tend to have more resources for children than we do for seniors by a long shot.
Our senior work group said one of the problems is we don't know where you can get affordable oral health if you're a senior. And so we said, we'll see what we can find out. And we put together, it's available on our website, a guide to affordable oral health services if you're a senior. And many people don't know that Medicare doesn't cover it. And for seniors, they're living a lot longer, so even if they did get dentures, they often don't fit toward the latter part of their lives. They're taking drugs that dry their mouth out, and you're more prone to get new caries if if your mouth is dry. So many reasons it's important for seniors to have good oral health. And when we looked for some funding to help programs, there was nothing. Everybody funds it for kids, but that's why we pulled the partners together and we're doing what we can. One great resource, I've got to put a plug in for Tri-County Health Department Senior Oral Health Program. They aren't in Aurora, but Aurora residents can go there, and that's one of the best resources for affordable oral health if you are a senior. So thank you to them. Another issue that we're struggling with in Aurora, not just with refugees and immigrants, but any of us, how many of you know the difference between an urgent care center and a freestanding emergency room? And we've got 4 freestanding emergency rooms in Aurora and over 20 urgent care centers. If you go in the wrong one, there is no wrong one. We're lucky to have so many options in Aurora. However, a freestanding emergency room does charge emergency room prices. So whether you have insurance and a copay, or especially if you're uninsured, the price difference can be
staggering.
Staggering is a good word. And so we have this whole campaign to help teach our community know where to go. And we say, if you have a primary care provider, a medical home, try there first. But if you don't have one or you can't get in, and it's not a serious life or limb-threatening emergency, know where your nearest urgent care center is. If you have an emergency, thank goodness you have options other than just the hospital-based emergency rooms. And then certainly if it's a behavioral health issue, knowing what your options are now, we're going to have to upgrade it, because now we also have some great programs like Dispatch Health that'll come to your house, and they take insurance. And now these teledoc resources, $49.95, and you can see a doctor on your computer who can even write a script for you, not for opioids. But so many options. It's confusing to know where to go. So we have a whole campaign that even says where to go in the event of a zombie apocalypse.
Yeah, I was a little confused by that, and then ultimately got some humor. Not at all.
We're trying to,
lighten
it up a little bit.
Lighten it up just a little bit. How are we doing on time, Stephanie?
You guys are good. Go ahead and keep chatting. Just everybody
Okay.
on the phone, please go ahead and write in your questions.
Great.
Sharon, could I just say one thing?
Yes.
We are a small group. I'd like to just say a little bit about what an incredible board we have. And it is a working board. Our staff is just myself and two incredible part-time folks. We're all contract. We don't maintain our own offices, so we keep our fixed costs very low. So how do we sustain ourselves, you ask? Well, the kindness of strangers and also affiliations. So most of the healthcare industry in Aurora, the larger ones, pay sort of an annual, we call it affiliation, to help support what we do. So we promise to keep our fixed costs low and bring value to the community, and luckily we've been able to demonstrate that. And so many entities in Aurora support us, for which we are really grateful. And our board of directors, there's 18 of them, and they represent most of the healthcare entities in Aurora, and some consumers are on our board as well. But as I said, it's a working board, and we couldn't do it without them.
Right. I think that's great to always, when you have a board that is a working board and not just a governing board, to give them a shout out. So in our conversation before we launched here, we didn't talk a lot about schools. And so I wonder if you have thoughts that you would share in terms of school health programs and any interface relative to the Alliance itself, or how you think that shapes Aurora's well-being.
A very important part, for when you're working with people, especially underserved or vulnerable people, you need to go where they are. It's really tough to get them, and I know it's inconvenient, but trying to get them to come to your meetings and where it's convenient for you to serve them. And so schools are an integral part of health education, health prevention, and health services in our community. And so we interact mostly with our school systems through our kids work group. And we couldn't do it without them. And not only the health care providers, but also the navigators. I assume it's happening in other schools too. Community navigators that help the family get the care they need. It's not just give the kid the shot or make sure, that specific issue is taken care of, but we're doing much better anymore of working with people and volunteers in schools who look at social determinants of health. And so every 2 years we put on a session called the Aurora Kids Convening, and Aurora Public Schools is a big part of that. And we just kind of check in, how is Aurora doing compared with the rest of the state, learn about new resources, and as in all of our meetings, a chance for networking. Again, we have so many resources. Sometimes you give people just the chance to interact together in the same room. They're going to solve problems and create programs and make those connections. Another entity I want to put a shout out to is the Juvenile Assessment Center that works very closely with the schools, but also Aurora Police Department, to try to head off, to have a place for kids to go between rather than just lock up or straight to the judicial system. And one thing we've really been impressed with what they do is they don't just look at why did the kid do what they did that day, but they look at the whole family situation and what are the resources that can help get the whole family back on the right track. So they're an invaluable partner. I could go on, but I'm going to stop. I'm getting up.
No, you can take a sip of water if you'd like.
Okay.
So in the social determinants of health has beautifully surfaced as being so essential, right, to overall community health, individual well-being, all of those things. It's a little squishy. I don't think it's a space where we can say social determinants of health and automatically we all go to the same component of that. I believe, and Civic is looking forward to doing more in that space where we can entertain those social determinants and figure out how the data helps inform some of those things. Transportation.
Oh, yeah, picked another one, Sharon.
So transportation is usually top of mind for me from a social determinant standpoint. And when we have kids in the picture, childcare is significant, and then food insecurity. So those are kind of my top three.
And housing,
certainly.
Yeah.
But you've alluded a little bit to housing. Talk to me a little bit about, and I think I would be curious about transportation.
Well, transportation comes up not just with kids. It's a big issue, too, for our seniors in accessing not just the medical care that they need, but their social interaction, that social component that they need so much. So non-emergent medical transportation comes up all over the place. Right. One of the things we found working with the Aurora Center for Active Adults, they have some great programs that they were encouraging seniors to come to, and not getting the participation they thought they should. Well, it found out that just figuring out how to use the public transportation system was confusing. And so when they added helping them figure out how to get a bus pass, how to ride the bus, how does Uber work, it really helped with their participation. Another project we did related to transportation was in our kids work group. Many people know perhaps that there is a Medicaid transportation benefit. Right. Can't say it works really well all the time. And so just talking to some of our members who work, especially with mothers, and the barriers that the Medicaid transportation regulations present to actually making it usable. So we wrote a paper on that. It went to Healthcare Policy and Finance, and they used parts of it for informing little things, unintended consequences that they that make it work a little better. So, but again, like housing, it's so big. I think it's why so many people don't even want to ask, how do you solve those social determinants that make it impossible for people that live health at their maximum. We did a study recently looking at life expectancy in the 17 zip codes in Aurora. We're in 3 counties. We've got 17 zip codes. And it was more discrepancy than in the Denver area. So there was a 18-year difference in your life expectancy in some of these zip codes in Northwest Aurora compared to zip codes like down around Southlands Mall. So that in and of itself, I mean, there's lots of reasons for that, but that just tells you what a different life experience people have living in one part of Aurora with another.
Right.
And transportation is part of that.
Absolutely. Thank you for that. I think we have to wrap up our discussion. So thank you.
Oh, thank you.
And I know that people will seek you out. You're not hard to find if they have questions. And I want to thank everybody who joined us as well. The recording of the discussion will be shared via social media and the Civic site on Monday. We hope you have a great rest of your week post the July 4th holiday, and you'll get information about our next change agent chat. Sometimes that's a
It's a
little
tough
tongue
one.
twister. Change agent chat via email and our regular communication with you. So thank you, Denise.
Thanks, Sharon.
Huge pleasure.
It was a pleasure to do this and talk about Aurora Health Access, but to do it with you made it all the more special. It's good to see you, my friend.
Yes, you as well.
And I'm going to jump in. We had a late entry
Okay.
into the question box.
Okay.
It is mentioned that the Social Security number is not required to purchase coverage on the exchange, Connect for Health, although applicants must be lawfully present and would have to provide documentation showing an eligible non-citizen status. In addition, parents who aren't eligible can apply on behalf of eligible children. If folks have questions about this, please email Civic at info@civic.org, and we can go ahead and get some information to you.
Wonderful.
Superb.
Great. Thank you.
Of course. And thank you all for attending, and have a wonderful day.
Great.